Well, welcome everyone to this session of the AI Nurses Network webinar. We have a great CNIO with us today, Peter White, who's going to talk about AI solutions for enhancing paediatric nursing care. Over to you, Peter.
Thank you very much. Hi, everyone. Yes, my name is Peter White. I'm the Chief Nursing Information Officer at Alder Hey, and we're a paediatric-only site in Liverpool, in northwest of England. We have a large number of patients that come through our hospital, about 330,000, and we are really keen to implement new technology because for our children and young people who use our service don't know any different. That's all they've ever grown up with. So when we think about smartphones and things, they were introduced, the iPhone came out in 2007. That was 19 years ago this year. So, it's older than our entire population base. So when we talk about AI tools that have emerged over the last 2 or 3 years, that's a huge number of our patients. So for them, it's very much their lived experience. But I just wanted to talk today, and really grateful for the opportunities to talk about some of the solutions that we have and been using. So, trying to pick up some of the sort of like hot topics today, and I have a horrible feeling this is going to age very quickly because the technology moves on so quickly that what we talk about today probably won't be relevant in 6 months. It'll be old news, and a lot of the things that we are trying to implement now, which seem like so far away, are actually coming along so quickly. But just some of the really key parts of the journey that we've been on over the last sort of couple of years. So the first thing I want to talk about, obviously, is ambient voice technology. And our journey through ambient AI so far was we had a pilot originally with a solution in October 2024, and we commenced with one team in December 2024 to try and look at how we could use this technology originally. And it's one of the few technologies where we've introduced it and our door has been hammered down. We've never known anything like it. Everybody wanted the ambient voice technology. They were so keen to engage with it. And as you can see, we had basically launched it to over 300 users by the time that the NHS guidelines came out in June. So we'd already had to have a number of safeguards in place, which thankfully aligned to the technology we had. And we were also really fortunate that the company we were dealing with were very proactive in getting their technology certified as a medical device. So they were one of the first that have actually had that certification, and it made our then wider rollout much easier. And so in December, we rolled it out to the whole trust. So that is now, it's available to about 2,000 users, and we have about 900 or so active users, mostly clinicians, but we do have a lot of the specialist nurses and some of the AHPs have been using it. And we're exploring new ways of using that technology. Mostly it's in clinics at the moment, which is obviously the easy way to start it, but we have had it in our ED department, and we've been using it for ward rounds and looking at how we could use it for multidisciplinary team meetings. So it's a really exciting technology. Just wanted to just talk about some of the benefits of it. I mean, you'll often find this when you're talking about ambient voice tech. It's the benefits are fairly universal, but the main thing for us, and particularly in pediatrics, is that it takes away that computer in the middle. And often it can feel like if you are a patient or a service user with a health professional now, they're always sat behind a laptop or with a computer to the side, or even if it's an iPad and they're trying to keep it out of the way. Whereas the ambient voice, it's a conversation, and it pulls all that information together, and it really does also help with getting things that you might have missed. And so, it might have been just a throwaway sentence or just something that wasn't necessarily focused at the time, but it does then pull in that information and it reduces that human error. We have seen that it does save time in clinic, and we've seen that we have some sort of variance between different professions, but it really does help with that workflow in the clinical environment, and we're really keen to see what other areas we can do. Obviously, there are some limitations. We do have it. There has been hallucinations that have been noted, but we have been really clear with staff that there has to be that human in the loop. They have to be validating the information. They have to make sure that they are checking that before it goes out. So we haven't really seen many incidents where there has been a hallucination that has reached the patient, whereby it's been contained in a letter or in the patient record. That's usually corrected beforehand. So I think with ambient and with it being such a new and emerging technology, it's really, really important to talk about some of the lessons learned, because I know that there's many people who reach out to me and some of my colleagues about, okay, well, how have you managed to implement this? What are the kind of things you wish you know now? Because many organizations are now in that procurement stage, or certainly in that early implementation stage. And I would say that first thing first is, be really open and honest to ensure the ethical use of it. You've got to consider the ethics, and this is something we've built into a lot of our strategy and things. There needs to be really clear kind of legal and ethical guidelines for when you're implementing the technology, and we've been very clear about that throughout, because I think just because it's new and it's fascinating doesn't mean to say you can't be really have robust procedures in place to make sure it's there. The training is, you think it's going to be quite easy, but it can be quite nuanced, and because it's a different workflow, a lot of people assume, particularly in ambient, that it's just going to be like speech to text, and so they talk like they would do if they were doing a speech to text document, and it's not that at all. You need that conversation, and you need to have that flow, and that's what the computer is looking for. If you just are going to use speech to text, then just carry on using speech to text. There's nothing gained by having the ambient. What the ambient is doing is picking up all of that nuance, that richness, and adding extra narrative and sort of body to a document. If you want to just use speech to text, carry on with your voice recognition, but you will see the benefits in it. The challenge that we had is particularly with some of the long form sessions we have. So within our developmental pediatrics and some of our psychology teams, their appointments go on for a very long time. Some of their assessments can be 2-3 hours long, and for an ambient system to be able to store all that information, you can imagine it trying to crunch all of that data and hold a 3-hour long conversation. That can be really challenging for the AI. So it's really difficult then to be able to sort of like make sure you don't overload the servers or completely melt the AI by giving it too much data to work with. And so that was just something that we found as we moved through that. But we have now got a new server in place that then can handle some of those longer consultations, and then scale early for impact. Make sure you are trying to get that out there as quickly as possible. You've got to be ready for people being really engaged with a digital solution for a change, not sort of going, oh no, what are you changing this time? This is very different. People will be very keen to implement it into their workflows because it is a really useful tool, and many people, myself included, use AI a lot more now, so we're becoming more and more comfortable with having GPT on our phones, or having Copilot for work, or having other solutions that are just there now, and so people are very keen to integrate that, but we do need to make sure that we're sort of like looking at those handling them safely, and sort of constantly validating them. So I just wanted to talk about our AI integration into our electronic health records. So in Alder Hey, we use Meditech, and at the moment we don't have anything directly embedded into the electronic patient record itself. What we have is our data warehouse, and some of those other platforms will be on the periphery, and we find this with other vendors as well. So I know that several other electronic health record systems don't necessarily have embedded systems, or they will have peripheral systems that help that. But we're currently in the process of upgrading our Meditech Expanse system to Expanse 2.2, and what that will provide is some of the APIs for the greater integration. And certainly in the United States, we've had demos, and this is one of the screenshots from the demos, whereby it can generate a summary for a letter, or you can have a summary for your nursing handover document, so that it will then pull all that data, the pertinent data, and be able to generate it. And I think that's really valuable for how we will use AI in clinical systems in the future. I really do see that summary analysis is going to be really vital, because at the moment we have so much data, it's overwhelming. And then when you are looking at root cause analysis, or you're looking at why didn't somebody see this really pertinent information, there's only so many times you can make something a critical event at the top of a patient's record, because if everything's critical, then there's no room for anything else. And so we try and be really careful with what our alerting system's doing, and what our flags and other ways of promoting information is there. Often this information can get drowned out if there's too much of it, so we're being really careful of how we justify that. But particularly for these kind of summary processes, it's going to be really useful, because the computer will know that I am a nurse and I am interested in the nursing documentation, and it will highlight the really key information for my profession, but also key information from others as well, so that it's there in a summarized format. And I think this will be really valuable to make sure that the information is handed over effectively, because we know that is a real gap often when handing over between groups. And then the personalized medication and medicine support will be the other big event in AI within health records, particularly about prompting for tasks or orders, or other actions that you need to do. Oh, your patient has met these criteria. At the moment, we have a lot of business analytics and clever algorithms and rules within the EPR to be able to do that, but we should be able to extrapolate that massively, and it will be able to offer up ideas of what you're going to need to do next, which I think will be just a nice prompt. It's not going to be doing the nursing for you. It will not be assisting a patient to mobilize, or getting them dressed, or doing a wash, or actually physically giving them medicines, but it will be able to prompt you and then take off some of that cognitive load of other tasks that you need to make sure you've done. So the other main event that we've had, and we've seen this across the NHS, is Copilot, and it's been so valuable as a tool within the organisation. It really does streamline so many activities, and you don't even realise how useful it's going to be. You just have it, say, as a button on your Outlook, for example, and then suddenly you find that you're using it in a document, or you're referencing it, or you're asking it to just enhance a slide, or just analyze this data for me, or make this into a graph, and you just suddenly find yourself using it very naturally. And it's been great to be able to see how many different things that it works with. What we've really found has been helpful, and what we've been using it a lot more for in the last probably 3 or 4 months, is helping to enhance our training materials, because we realize that sometimes for the education team, the documents they produce could either be too long, or not detailed enough, or not really effective at getting the workflow across, or doesn't have nice diagrams and things. Copilot sorts all of that out for you, and so it means that the training documentation is much more effective at being able to support staff, and not necessarily have to go through a 20-page booklet on how to do a process or use something. You've got really nice, succinct training materials and things, reference materials that support staff. The other really great thing has been for supporting staff, particularly some staff who've got, say, dyslexia, or providing systems to make it easier to visualize information. It's been really useful to be able to have that accessibility enhancements beyond what is out of the box within Windows. So I just want to talk really briefly about the clinical safety, and this is definitely an emerging area, and it's kind of each organization is doing its best to manage this process. So for the clinical safety, we have the DCB 0129, which the vendor will fill in, and we have the DCB 0160 safety case and hazard workshops that are run, and that's on the customer. So in our case, Alder Hey. And we've had that in place for everything since 2023. So all new systems that come through will have a process of review for that. And part of the challenge with particularly the DCB 0129 and AI products is that the technology behind it is protected, and they're not going to tell you, let you peek behind the curtain and tell you how their algorithm works or what their large language model is doing. And so it's then very difficult to say, right, well, how can we make sure that this is safe? Equally, a lot of the processing, they can't tell you where it is. Normally, we would have, say, a server that we manage on site in a secure environment. Well, if it's going off to an Amazon or a Microsoft server somewhere, we don't know if we can be assured that it's being processed within the correct territories or safely, and so we need to make sure that we've got that transparency. And so that's been really difficult to navigate because, again, we don't necessarily have that backing, the kind of national backing to say what this should look like for AI technologies. It's really robust for legacy programs and solutions, but that's still emerging. Equally, the MHRA for the safety of the medical devices is still only just emerging, of what level it should be and how it's graded and things. So again, a lot of this is done with an assumed understanding that we are interrogating and ensuring that safe and robust systems have been delivered, but it's still emerging. And I know that this slide in particular will be completely different in 6 months' time, because there will be the infrastructure around us to support us, and we will be able to talk about it more freely. The one thing I would say is, and this is something we did very early on, was within our AI board that we had established about 2 years ago, we do make sure we have representation, and we do refer things to the legal team. We do make sure that the ethical team are looking at things, because we have to make sure that when we are introducing something, say like our ambient voice technology, that there isn't going to be any concerns. Our children and young people with mental health disorders, for example, will feel that they are being monitored, or they could have a potential for paranoia because the system is listening to them without their knowledge, or families might be concerned that the AI is going to do something to their data, or they're not going to be treated in the same way as if they had the AI turned off. Equally, we have the opposite, where families want the AI. They want they want to make sure that their cancer is being picked up by a computer because it's more vigilant than a human, for example. So you've got to balance that to make sure that we have got a clear and unbiased view of when we are looking at technologies and what we can implement for children and young people. And we do have that responsibility to make sure it is effective. And the problem in paediatrics is always, we're usually behind the bottom of the list. So adults, easy peasy. Care of the elderly, yep, that's great. Mental health is still a bit more, sort of not as well understood, but paediatrics will come to you at the end. And so for us, as a kind of large children's health organization, we're really striving to be engaging with companies. And that's the beauty of digital, is that it's more agnostic. We are really able to engage with partners and deliver new solutions quite quickly. And then really the one thing we need to talk about mostly is research, and this is the research and validation of the systems and solutions that we're using. At the moment, there is limited research in digital nursing in particular, and I'm leading on a project looking at how we can improve that digital nursing. But it's not without groups like this that we need to be striving to push the AI and ensure there is an evidence base to support it. I think what's really difficult is in the kind of digital landscape is, well, as a nurse, we pride ourselves on our evidence-based practice, but when we actually critique that ourselves and say, well, what is the evidence base for ambient voice technology over, sort of the business side of, oh, well, it saves 8 minutes in a clinic. That's not the same thing as it being really critiquing it, validating it, and ensuring that it's safe. So we need to have more research. The issue is that the pace of changes makes it really difficult. If you're monitoring or researching something now, by the time you get to publishing in maybe a year or 18 months' time, the technology has advanced so far that actually it's then very difficult to say, oh, well, this is exactly what it's like at the moment. But we do have a duty to be able to support that. So I'm very passionate, and I work very closely with our research colleagues in our organization about how we can validate, how we can perform research and do that with the technology and the systems that we're doing. And we have had a couple of papers out from Alder Hey, from some of our clinicians, looking at the ambient technology, which has been, it's really good that we can then contribute to that evidence base. But I would encourage everybody to get involved, get researching and help. Final slide is obviously the Older Hay AI strategy, and we were one of the first organisations to publish this. Really proud of the work that we put into making sure that we can explain to our children, young people, and their families about what our plan is for the AI within the trust. We do have a small team who are dedicated to AI. We've got a number of different solutions we've been developing for some time. We've also had some really exciting sort of showcases of the technology that we've been developing as well, and we're really keen to keep getting the latest technology to support, as I say, our families, but also to the wider health base. It makes sense that we could be able to partner up with others to really support it. But I think that's it. Yes, that's my email address, and I'd be really keen to engage anybody who would like to. Yeah, it's fantastic. Thank you very much.
It's great, Peter. Thanks so much. There's so much happening, as you said, in AI. It's hard to keep up with it all. I'm just really
Absolutely.
curious, as a nurse, how did you get started yourself in AI? Was it just kind of happening in the hospital anyway, and yeah, you were having discussions about it?
Yeah, so in Alder Hey, we have a data scientist who was really passionate about AI solutions and was developing with our innovation team. So it was actually based within our innovation team and looked at some solutions for was not brought. So when children aren't brought to hospital. And so for myself, I was really keen on, well, how can we understand that? How can we use some of that data, that sort of it was called big data in those days, but it was really about
Mm,
how can we use these solutions to make our lives better. And yeah, we've had some really interesting sort of conversation about, okay, yeah, we could do this with the information. A lot of the challenges, though, particularly working with the data scientists, is the data quality of what we're
mm,
going on, and the AI is only as good as the data it's got to go in. I mean, when it really sort of supercharged for me was I went to a conference in America a couple of years ago, and they were talking about what they'd been doing, and I was like, well, we've got much better infrastructure than some of the stuff they were talking about. Why are we not using more of our systems to drive this? So yeah, I've been really passionate about AI for a few years now.
good. Yeah, great. Because I know, yeah, a lot of people weren't really aware of it or interested until ChatGPT came along, but it has been
Yeah,
around before, since before
yeah,
then.
yeah. It has been around a little while.
Great. Yeah. And do you have any advice, I guess, for nurses who want to get into AI and maybe do some AI research as well? That's definitely important.
So what I would say is link in with your digital lead. So if you are a digital lead, the best thing to do is join this group and also get in, liaise with kind of research colleagues within your organization. Reach out to your local CNIO or regional CNIO if there is one. There's plenty of topics on the Futures website as well. There's a really active community there that's brilliant. And I'd also say, there's lots of people who are really excited in this space, and so it's a great time to get into AI nursing, because I think as digital
Mm,
nursing has evolved very rapidly over the kind of last 10 years, it was great. COVID was to really helped with getting the digital
mm.
nursing profession. Now, with the advances in AI, the AI nursing profession, I think, will start to come along together. But yeah, it's a really active community, and I think really exciting. So yeah, there's plenty of people around who can help.
Yeah, definitely. And I know the NHS in England anyway has the AI Ambassadors Network as well, which I'm a member of, and I'm sure lots of colleagues are. So that's another good
Yeah,
resource to tap into
yeah, yeah,
if you're in England. Yeah,
yeah.
and I've got one more question, which is a bit tricky. Where do you think AI is going to go in the future, and what kind of trends should nurses be looking out for?
Well, that's a really, really good question,
I
because
know.
even 6 months ago, I probably wouldn't have been able to tell you, where we are today. But I think
Mm,
certainly in the not too distant future, the AI will be kind of a supportive model of as I was saying in my presentation, kind of the prompts, or
mm,
being able to suggest different things. It would be great if like the ambient technology was almost like a kind of a Siri or Google, where you could say, particularly if you're with a patient, oh, could you order their lunch, or could you
mm,
um, get something for me, get some orders from the pharmacy or whatever, and you can almost use the voice technology for that. I think with the main element is going to be about trying to ease administrative burden and focus on that face-to-face patient care, and taking away that, so you could almost speak out any observations, because there's limitations to what the computer can pick up. We've got lots of integrated observation devices, but what do you do for your fluid balance? How do you know how how much food a patient's eating, or how do you know that they've been able to mobilize today and things? And you can see how you have to type that into a computer, or you have to put that into a computer, and some of that ambient stuff, or certainly some of the other AI technology to be able to do that. I think the other thing is that the main thing is hospital at home. How can we have better monitoring? It shouldn't be about patients in bed spaces. It should be about patients being able to be as independent as possible and be at home. So I think some of those technologies will be really valuable, and it would be great. The final thing would be really great is like monitoring for deterioration, so sepsis or observation, general deterioration, and being able to proactively advance that. In 12 hours or 72 hours, you are likely to be deteriorating, and be able to get that much more advanced look with small changes that are already there. And we've seen that kind of already in imaging with oncology and cancers, where teeny tiny things that are almost microscopic now are being picked up and treated much earlier than they would have been in the past, because it had to get to a state. But the AI solutions there are able to pick that up and say, okay, this is going to be a problem in a year or 5 years, deal with it now. And I think that's where we it would be great to get to.
Yeah, the predictive modeling has definitely come on leaps and bounds the last couple of years, and now all the kind of multimodal modeling that's happening, where you've got video data and other types of data. I think if we can get the integration of the devices sorted, then we'll have a much richer data set to work, which I know is like an impossible challenge, but yeah, we'll have a much richer data set to work from, and better prediction and prevention, hopefully, which is where all healthcare systems should be going.
Exactly.
Keep people out of hospital and at home where they much rather be.
Absolutely.
Great, lovely. Well, thanks so much for your time, Peter, and I'd love to hear what you're doing. And hopefully we'll be able to check back in maybe in a year or two and see if AI has taken over.
I really look forward to it. Yeah, it'd be great to
Yeah.
come back and tell you all the amazing things we've done. But thank you so much for having me.
Great, thanks.